Assalamualaikum everyone. So today in this video I'm going to discuss the next chapter, white cell disorders, of chapter number 12, hematopoietic and lymphoid systems from the medium Robbins. First of all, we have the neoplastic disorders of the white cells, in which just go through the leukemia. This is important for the MCQ's point of view, its morphology. And then table 12.6 causes of the leukocytosis. You can just skip the reactive lymphadenitis, cat scratch disease. These topics are basically not important for the SCQ or the MCQ's point of view. Next, we have the neoplastic proliferations of the white cells, in which we should know about the lymphoid neoplasm, myeloid, and the histocytic neoplasm. These are important for the MCQ's point of view. And then this is the first important SCQ of this topic, 12.7 table, WHO classification of the lymphoid neoplasm. These are important for the SCQ's and the MCQ's point of view. And then we have the precursor B and T cell neoplasm, in which we have the acute lymphoblastic leukemia or lymphoma. This is important for the SCQ point of view. Its morphology is important, its pathogenesis is important. You should know about the affected gene, for example, Notch1 gene. These are important for the MCQ's point of view as well. And then we have its immunophenotype is important for the SCQ and the MCQ's point of view as well. Just go through the clinical features. These are important. And then this diagram is important for the OSP, figure 12.4. And then we have the next topic, chronic lymphocytic leukemia, which is also known as a small lymphocytic lymphoma. This is again important for the SCQ point of view. So just go through its morphology, its immunophenotypes, and its genetics. This is important. And then this diagram is again important for the OSP point of view. Go through the journal features, and then its immunophenotype of follicular lymphoma is basically not important for the SCQ point of view. Just go through it for the MCQ's point of view. Then we have the mantle cell lymphoma. This is again not so important topic, extranodal marginal zone lymphoma. Just इसमें से MCQs आते हैं. And then we have the diffuse large B-cell lymphoma. Its morphology is very much important for the exam point of view. Its pathogenesis is important. Its affected genes are important from the MCQ's point of view. BCL6 gene, which is basically located on the 3q27, and the MYC gene. Then again, this is important for the MCQ's point of view, figure 12.17, that the tumor cells have a large nuclei with open chromatin and the prominent nuclei. This is important for the MCQ's point of view. Then we have the Burkini Lymphoma. This is again important for the SCQ and MCQ's point of view. It's this feature, starry sky pattern. This is very much important. This scenario mein aata hai, so this is important for the SCQ's and the MCQ's point of view. You can just skip the plasma cell, neoplasm, and related entities. These are not so important. Multiple myeloma is again important for the SCQ point of view. Its pathogenesis and most importantly its morphology is very much important for the SCQ point of view. Then you can just skip the lymphoplasmacytic lymphoma. Hodgkin lymphoma is very much important for the SCQ point of view. Difference between the Hodgkin and the non-Hodgkin lymphoma बहुत दफ़ा past papers में आया, so this is very much important for the SCQ point of view, especially the RS cells, Reed-Sternberg cells. These are very much important, which are basically diagnostic of the Hodgkin lymphoma. Its morphology is very much important for the SCQ point of view. And then we have its pathogenesis is again important, but morphology is more important than its pathogenesis. And then this is the table, difference between the non-Hodgkin and Hodgkin lymphoma. This is important for the SCQ point of view. Table 12.10, clinical staging of the Hodgkin, non-Hodgkin lymphomas, which is basically known as Ann Arbor classification. This is important for the SCQ point of view, very much important. Then you can just skip the hairy cell leukemia. These are not so important for the SCQ point of view. Then we have the myeloid neoplasm. This is important, in which we have the acute myeloid leukemia. This is important, AML. This is important for the SCQ point of view. Its morphology is basically important. And then we have its immunophenotype is again important for the SCQ and the MCQ's point of view. 1 या 2 marks का question आ जाता है जिसमें just आपसे phenotype के बारे में पूछते हैं. So this is important. Its diagnostic or bodies are important. Myeloblasts are important. Then this figure is important, 12.26 for the OSP point of view. Then against classification, table 12.11, WHO classification of AML. This is important for the SCQ point of view. FAB classification of AML. This is basically not given the medium Robbins. Big Robbins में दी हुई है और FAB classification नहीं आती है. So this is important for the SCQ point of view. Past papers में भी दी होती है. And then we have the chronic myeloid leukemia. Its pathogenesis is important for the SCQ point of view. It's effective gene basically which is BCR-ABL gene. This is important for the MCQ's point of view, T922. And then its morphology is important for the SCQ point of view. Just go through the clinical features. You can just skip the primary myelofibrosis. This is not important. You can also skip the histiocytic neoplasm. Then we have the bleeding disorders. This is again the most important topic of this chapter, and this is the last topic of the hematopoietic lymphoid system. You should know about the thrombin time, partial thromboplastin time, and the platelet count. These are important for the MCQ's point of view. और scenarios में भी आते हैं. And then DIC, disseminated intravascular coagulation. This is again important for the SCQ point of view. इसकी pathogenesis बहुत ज़्यादा पूछी जाती है. Figure 12.30. This is very much important for the exam point of view. Then we have the table 12.12, major disorders associated with disseminated intravascular coagulation. This is again important for the SCQ point of view. Morphology of DIC is very much important. Its clinical features are important diagnose करने के लिए, और इसके laboratory findings are very much important, जिसके अंदर होता है कि हमारे पास FDPs raised होते हैं, हमारे पास fibrinogen जो होते हैं वो raised होता है. These are again important for the SCQ point of view. 1-2 marks का ये question आ जाता है. Then we have the thrombocytopenia. Just give it a read for the MCQ's point of view. You should know about all the types immune thrombocytopenic purpura, heparin induced thrombocytopenia, and the thrombotic microangiopathies. These are important for the MCQ's point of view. बहुत rare होता है कि SCQ में आते हैं, but mainly these are important for the MCQ's point of view. Then we have the coagulation disorders, in which we have the deficiencies of factor 8, von Willebrand factor complex, which is basically the hemophilia A. This is important for the SCQ point of view. Von Willebrand disease, this is again important for the SCQ point of view. And then we have the hemophilia A. This is very much important for the SCQ point of view. You should know about the hemophilia A and hemophilia B, which is basically less important. Hemophilia A is more important. Then we have the complications of the transfusion. Just know its heading. For example, allergic reactions, hemolytic reactions, and the transfusion related acute lung injury and infectious complications. So disorders of the spleen and thymus, just give it a read. Massive splenomegaly में क्या होता है, moderate splenomegaly में क्या होता है, और mild splenomegaly में क्या होता है. ये these are important for the MCQ's point of view. कभी भी SCQ नहीं आया इनमें से. And then you can skip this last topic, disorders of the thymus. These are not important for the MCQ's or SCQ point of view. So this is all about chapter number 12, hematopoietic and lymphoid system from the medium Robbins. Inshallah we will discuss next topics in my next video. Thank you so much. Allah Hafiz.